Hello, my friends. My name is Stan, and I'm acupuncture practitioner and osteopathic practitioner from Canada. Today, I'm gonna teach you guys how to treat acute lower back pain. All right. So, the first medicine that we know existing in the world is acupuncture. It's over 3,000 years. The last medicine what we know, last science is osteopathy, which is over 140 years. So what I'm doing, I'm combining these two modalities together and using that during my treatments. So what connect with these two modalities? Its body is one unit. What does it mean? Everything in our body interconnected and interrelated. So, for example, I can treat elbow from the shoulder, or I can treat elbow from the knee, and vice versa. All right. So today I'm going to teach you guys how you can treat yourself your lower back pain, especially acute one. I use this method on everyday basis because the most of the cases who come to my office is the people complain on the lower back pain. So what you have to use, pencil with a rubber end, or you can find some device like that with a round corner. If it's very acute pain, you have to stay on the bed for the first 3 days and don't move. Find position with the pillows, put pillows in between your knees, flex your knees and stay calm. You have to find position with the zero pain and stay as much as you can. Then pain subside. Use also ice, okay? So 20 minutes on, 20 minutes off to remove inflammation, to reduce inflammation. So now, how we can treat it? So I already created some lines. So I create some lines on my hand, but it's a little bit later. Okay. So lower back pain, usually located in this area, and you see it's urine bladder channel. It's big, like it's couple lines here, couple lines on that side. So we can call it sick meridian, because on this meridian we have no energy flow. We have to bring it back. So what we can use, in this case, I can use the elbow to treat lower back pain. So it's three things you have to do, you have to memorize. First thing, you can use your elbow. So elbow gonna be, the palm gonna be like that, and you will see the line. So it's gonna be middle line here, and that's gonna be lung meridian, and here is the heart meridian. So how you can treat it? So you can go a little bit above midline or below midline. Okay, same thing here. You have pencil, and you can go deep inside and start to press and find painful spots. Okay, when you find painful spot here, you have to go deep and start to move it, like clockwise, counterclockwise, and you can go deeper. And when you find spot, you start to squeeze your wrist, okay, till pain going to be subside here. It's take, every point can take probably 1 minute or more, 1.5 minutes, sometimes 2 minutes. You have to reduce pain for at least 70% on this line. Same thing, this line you have to find, okay, and find painful spot. It's going to be very painful spot. It's related to your lower back, and go deep. You can use maybe your fingers as well. Go deep inside and mobilize it. You can use two hands, same thing. All right. So if you precise, if you find the spot, the pain going to be eliminated very fast. You're going to be surprised how it's fastest work. The second thing we have to do, it's your wrist. Okay. So this covered by the skin. So you have to go in between the bones. 1, 2, 3. Okay. What does mean? You have go with your pencil in between two bones, here, here, and here, and as well you palpate close to the bones, okay, and find the painful spots. When you find painful spot, go deep Go deep, like you're almost crying because it's going to be painful. And start to work with your wrist. Squeeze it and release till pain going to be subside. At the same time, try to move a little bit micro movement on your lower back. Okay, and the same thing you can do here, and same thing you can do here. And last thing you have to do, you can use tennis ball or something like that. We have to treat your lower back from the shoulder blade. Shoulder blade is bony structure, triangle bony structure on your back. So how to treat? You have to take the ball, put on the shoulder blade, and come close to the wall. Okay, and push the ball with your shoulder blade, and you have to move it up and down till you find painful spot, and stay on the spot till pain going to disappear. So usually when I do this right, the pain after the very first treatment going to be subside by 70%. All right, so try it. You're going to be surprised. It's really like magic, and I see this magic on my daily basis. And I'm going to show you guys, and I'm just gonna show you guys how it's simple. Everything in our life is much more simple than we think. People make it complicated, right? Use this technique and you're gonna be enjoy. Thank you, and I can teach you something else, of course.